I hear it every single week. Once I get Medicare, all my healthcare is covered, right? Wrong. Medicare has excellent coverage, but it was never designed to pay for everything. There are gaps that could leave you responsible for $20,000, $50,000, even six figures if you're not prepared. I've been helping people through Medicare enrollment in Northwest Ohio and Southeast Michigan for years. I've sat across from retirees who thought they were fully protected and found out too late that Medicare left them exposed. I'm going to walk through the 6 biggest gaps that shock people most. No out-of-pocket cap, no long-term care, prescriptions not included, dental and vision not included, limited overseas protection, and the enrollment mistakes you can't undo. By the end, you'll know exactly what Medicare covers, what it doesn't, and how to protect your retirement savings. Medicare has no out-of-pocket maximum, and that 20% can bury you. Most people assume government insurance comes with a cap on what you'd pay every year. That's how employer plans work. Original Medicare, no cap, none. A client had a stroke, followed by months of inpatient rehab. Medicare covered most of it, but she still owed over $30,000. Here's why. Original Medicare pays about 80% of approved expenses after deductible. That sounds great until you realize there's no limit on the remaining 20%. A $100,000 surgery? You owe $20,000. Cancer treatment over 6 months? That's 20%, and that compounds fast, with no annual maximum where insurance picks up the rest. This is why most people add either a Medicare supplement, which eliminates most or all of that coinsurance, or a Medicare Advantage plan, which caps your annual out-of-pocket. When you understand this gap before you enroll, you get to choose the right protection. You don't discover it after you're staring at a $40,000 bill. Medicare doesn't cover long-term custodial care. And that's the gap that could cost you everything if you need help with everyday activities like bathing, dressing, eating for an extended period. Medicare generally doesn't pay for that. Family I worked with was certain Medicare would cover their mother's memory care. It didn't. The facility cost was $7,000 a month. They burned through her entire retirement savings in 18 months. Here's the distinction that trips people up. If someone needs skilled nursing rehab after a qualifying hospital stay, Medicare covers that up to 100 days. But if someone develops dementia, Alzheimer's, or simply ages to the point where they need daily help, that's custodial care. Medicare does not cover it. The numbers are staggering. Long-term care runs $50,000 to over $100,000 a year, depending on where you live. Yes, Medicaid eventually pays, but only after you've spent down nearly everything. The worst answer is assuming Medicare has you covered and finding out the hard way that it doesn't. This is a separate financial planning conversation, and it needs to happen before a health crisis forces your hand. Prescription drug coverage isn't automatic, and one wrong move creates a permanent penalty. Most people assume drug coverage comes with Medicare. It doesn't. Original Medicare covers almost no outpatient prescriptions. If you want drug coverage, you have to add it separately. A client enrolled without a Part D plan because she took no medications at the time. 6 months later, she was diagnosed with type 2 diabetes. By then, she faced a late enrollment penalty she'd pay every month for the rest of her life. To get drug coverage, you need a separate Part D plan or a Medicare Advantage plan with drug coverage built in. And that penalty is permanent. Beyond the penalty, every Part D plan has a different formulary and different copays. A medication covered well this year might move to a higher tier next year. People stay on the same plan for years without reviewing it and realize they've been overpaying by $1,500 or more annually. When you first enroll, compare plans based on your actual prescriptions using Medicare.gov or an independent advisor. Then, review every October during annual enrollment. Don't assume last year's plan is still the best fit. Routine dental, vision, and hearing aren't covered. It adds up fast when people picture Medicare covering their health care. They assume the basics are included. Dental cleanings, eye exams, glasses, hearing aids, but original Medicare excludes nearly all of it. A couple I worked with didn't plan for $3,000 in dental work, $800 for glasses, and $4,500 for hearing aids, all in the same year. They thought Medicare covered it. It doesn't. Routine cleanings, fillings, dentures, not covered. Eye exams and glasses, not covered. Hearing exams and hearing aids, not covered. Over a 10-year retirement, those costs add up to tens of thousands of dollars. And these aren't luxuries you can skip. Untreated gum disease is linked to heart disease and stroke. Hearing loss affects your independence and safety. This is one of the main reasons people choose Medicare Advantage. Many plans include routine dental, vision, and hearing benefits. Whatever path you choose, budget for these expenses as part of your annual healthcare costs. Medicare doesn't handle them. Medicare stops at the US border, and international emergencies can get catastrophically expensive if you become seriously ill or injured outside the United States. Original Medicare usually provides little or no coverage. That gap could cost $50,000, $100,000 or more. A client who spent winters in Mexico had a stroke. The local hospital stabilized him, but Medicare wouldn't cover the airlift home. His family paid $35,000 for medical evacuation out of pocket. Picture a heart attack in Europe. Emergency surgery a week in the hospital, a flight home. Medicare pays zero. Many foreign hospitals also require payment up front before they'll treat you. If you travel internationally, even occasionally, buy travel medical insurance that includes emergency medical coverage and evacuation. Some Medicare supplement plans cover 80% of emergency foreign care during the first 60 days of travel, but that's emergency only. And if you're a snowbird spending months abroad, review your Medicare Advantage plan's international coverage carefully. Don't assume Medicare travels with you. It doesn't. The biggest gap is making the wrong decision at enrollment, and any mistakes can't be fixed later. Every gap I've covered can be addressed with the right planning, but many Medicare decisions lock you in. Make the wrong choice during your initial enrollment period, and you may not be able to change later without health questions or higher premiums. A client chose a zero premium Medicare Advantage plan at 65. 3 years later, she developed a chronic condition and wanted to switch to a Medicare supplement. Every company either denied her or quoted premiums 2 to 3 times higher. She was stuck. Here's why. When you first enroll, you have a 6-month Medigap open enrollment window. Guaranteed acceptance, no health questions. After that closes, insurers can deny you based on your health. Late enrollment penalties are also permanent, and supplement premiums vary wildly between companies for the exact same plan, meaning people overpay $50 to $100 a month simply because they didn't compare. Start researching 3 to 6 months before your initial enrollment period. Work with an independent Medicare advisor who can compare medical companies and explain the trade-offs in plain English. Don't pick based on premium alone. Consider your doctors, prescriptions, health, and budget. If you're turning 65 soon or helping a parent through this, don't wing it. If you're turning 65 soon, retiring, or want a second opinion on your current coverage, reach out for a no-cost Medicare review. I'll walk you through exactly what Medicare covers, what it doesn't, and how to protect yourself before you're locked in. If you're in Northwest Ohio or Southeast Michigan, call me directly. Number's in the description. And if this helped, share it with someone approaching Medicare age. Most people don't find out about these gaps until it's too late.